Hey everybody, it's Dr. Nicole with Healing Hands and welcome to our short episode on postural distortions. So I have a question for you. If you notice that you have postural distortions, what should you do, right? Well, the first thing is you need to be checked. So in our office, we do a thorough checkup, including palpation, range of motion. We do a very thorough computerized posture check, and in most cases, we take x-rays. Now, if we find that a person has postural distortions, the first question is can we fix it? So sometimes a person has had these misalignments in their spine or these postural distortions for so many years, there's permanent damage in the spine. So if you feel like you may have damage to your spine or you've had injuries to your body, you definitely want to have your spine checked as soon as possible, because the longer those problems are left uncorrected, the harder they are to correct, okay? Just like anything else. But once we find out that we can correct a person's condition, there are 4 major areas that we have to address in order to correct them. The first one is frequency of care. Now, because most people have had these misalignments in their spine or these postural distortions for sometimes decades, in the beginning of care, a patient may only hold their correction for a window of about 24 to 48 hours. I know that doesn't sound like very long at all, but the good news is that the spine is very trainable. So over time, the person will hold the correction longer and longer and longer until it becomes a permanent correction for you. So the second thing that we need to address is the muscles around the spine. Now, here, you're just looking at my spine with no muscles, but this thing is bound by tons of muscles and ligaments. So we retrain the spine using a physiotherapy exercise called neuromuscular reeducation. What neuromuscular reeducation does is it establishes new muscle memory in the muscles around the spine that help us to take the spine from an abnormal position and actually correct it, so that we're making a more permanent correction for people, more long-term. The second thing that we need to address are the ligaments. So same thing as the muscles. All these bones are bound by ligaments that have been holding the spine in its abnormal position for a really long period of time. So what we use to remold the ligaments is something called traction. Traction is totally customized to each individual condition and each person's case. That's determined by x-ray. So we're very specific when we are correcting spines. And then the fourth thing is, of course, the spinal joints. So when the spine gets knocked out of alignment, the joint gets stuck or it gets fixated. So the spine actually gets stuck into that abnormal position, causing stress to the nervous system. That creates inflammation and decreased nerve flow to different organs of the body, which causes disease in the body, as you already know. So in order to get the joints to move properly, we apply a very gentle and a very safe chiropractic adjustment to the spine in order to move the spine and shift the spine back into its normal alignment. So I know that many of you had many different experiences with chiropractic in the past. I'd love to know your questions, concerns, comments. Make some comments in the comments below. Show us some love. Tell us what you appreciate about these videos. And of course, if you have any questions, either ask them below or you guys know where to find us. Have an awesome day.